Okay, so this is morning rant time. I wanted to talk about something, like one of my medications, so Seroquel. I have a love-hate relationship with Seroquel. I've been on it for probably like 5 years now. I've been on a range of different doses, everything from like 25 milligrams to like 2,000 milligrams, both fast-acting, long-acting, combinations of everything in between. Seroquel is like an antipsychotic and a mood stabilizer. I've never been psychotic, but I know like the sort of what they normally do with bipolar disorder is they'll prescribe you lithium and then they'll prescribe you Seroquel as well. It's often paired together, and I think the main reason for that, particularly because I've got bipolar 2, so no psychotic episodes, the main reason that they prescribe it is because it's a safe sleeping pill. You can't kill yourself on it, trust me. You'll just knock yourself out for about 3 fucking days and you'll be comatose and cranky and irritable and you won't be able to like move your body, but you might be awake because you can't actually sleep for that long. It's really shit. So that's why I think they prescribe it to a lot of bipolar people. It also kind of slows down your thinking process a little bit, which it might not seem like the best thing. But I guess I stopped taking my Seroquel recently, not under doctor's advice, just a personal choice, which I think is a mistake now. I don't know. I'm really drowsy in the morning, really drowsy. Like Seroquel knocks me the fuck out at night, and I really struggle to wake up in the morning. So I decided to stop taking it. And this is my experiences since then. This is probably like 4 days ago. I decided that. And I've still been waking up like drowsy in the morning. So I don't know whether that's just like my sleeping cycle and the issues that I'm having there. So that could just be that. One thing I have noticed is my thoughts are increasingly getting faster. I'm really foggy in my head. I really catch myself talking to myself. My mind is not quiet. It's really racing. There's like a lot of shit going on there. Not in like a manic way, like there's no symptoms of mania, but it's just like my brain is confused. There's stuff going on like everywhere. And I think like for that reason I might start taking my Seroquel again. And I just wanted you guys to know that. I think sometimes like you think a medication's not working, you don't like a medication, but you realize like when you stop taking it that it does play kind of a small part in your treatment. And that, you know, when you add the different types of meds and the combination together, you know, that's how you get that state of mind. But they're all like a piece of the puzzle. And yeah, I often play with my own medication. I really shouldn't, but I mean, it's like sometimes I know more than like the psychiatrist, and I think no, I don't, but I know like more about myself and know more about what I need, and it's really hard to get an appointment with a psychiatrist. Like I can't afford it, and that's shitty. Like that's a bit stupid. So Australia is like one of those places. It's like if you're not fucked up enough like for the public system, then you just fall between the cracks, like especially if you can't afford private treatment. So that sucks. And also one thing I've learned with the Seroquel is there's no point taking Seroquel if you drink, because Seroquel stops working. And that's for a lot of medications actually. If you drink alcohol, your medication doesn't work. It actually depletes the chemicals in your brain. So if you know, these psychiatric medications, they take about like 2-3 months to kick in to build up the level of chemicals that they need to actually work properly in your brain. So like one night of drinking, you've depleted like 2 months of chemicals. So you'll feel that naturally like shit afterwards, because then you've got to rebuild the 2 months up again. And if you're drinking on a regular basis, then no wonder your meds aren't working. Like, no wonder you feel kind of like unstable. So, yeah. Keep that in mind, guys. Morning rant. Please subscribe because I'm trying to do videos every day. Thanks, guys.